This paper was published on Blood Review some months ago. It is a paper that I wrote together with some colleagues from the internal medicine department of my institution, Nancy University Hospital, and in particular Dr. Moulinet, who I collaborate with on the management of these cytopenic patients. In this paper, we made the effort to summarize key aspects of the immunobiology and the therapies for patients with immune-mediated thrombocytopenia. Starting from a classical ITP scenario and covering other poorly codified situations such as thrombocytopenia after immunotherapy or cellular therapies, which are common challenges for many physicians with patients that could never recover also a normal platelet or a normal blood count. So ITP, once known as idiopathic thrombocytopenic purpura, is an autoimmune disorder encompassing several mechanisms from T and B cell dysfunction with antibody-dependent cellular phagocytosis or complement-dependent cytotoxicity, as well as megakaryopoiesis alteration. And this condition may be idiopathic or triggered by drugs, vaccines, infections, cancers, or autoimmune disorders and systemic disease. And what we suggested with this review perspective paper was that other forms of thrombocytopenic syndromes, such as, for instance, occurring after immunotherapy of cellular therapies, including CAR T cells and even allogeneic hematopoietic stem cell transplantation, may share common pathophysiology with ITP, with several ITP mechanisms, with possible also therapeutic implications. So the problem is that literature is very scarce on these subjects, and if a decent pipeline of drugs is currently deployed or under development for classical ITP, in other more complex immune-mediated thrombocytopenic disorders, clinical management is less harmonized and would deserve further prospective investigations. So with this review, we wanted to promote the message of the overlapping pathophysiology, overlapping mechanisms of these immune-mediated thrombocytopenic disorders and unmet therapeutic needs that would deserve to investigate which patient could actually benefit from agents that are already approved for ITP, but that could be used with the indications also in more complex forms of immune thrombocytopenia.